photos of Irma Easton show a young, dark-haired, luminescent beauty whose life brimmed with promise. Decades later, her life ended June 8th when paramedics failed to revive the 66-year-old after she choked on powdered donuts in her room at Avocado Post-Acute in El Cajon.
She didn't have to die this way, and they should have been more conscientious of what they were doing. I mean, they're trained nurses, they're trained medical staff there. So what are they getting paid for? What are they doing?
Easton's daughter Beatrice Barrios says an avocado nurse had given Easton a pack of the donuts, then left her alone to eat them, despite the fact that Easton was a diabetic and needed her food mechanically softened due to a swallowing disorder and a history of choking.
Obviously, they're not providing proper care.
Delivering proper care has been a challenge at Avocado. KPBS reviewed Avocado's financial reports with the help of lawyer Ernie Tosh. He is a nationally recognized expert on nursing home finances. We found the for-profit facility has failed in recent years to provide the level of nursing care expected by regulators. The regulators, the Centers for Medicare and Medicaid Services, published the expected level of staffing and reimbursed Avocado based on the needs of the facility's residents. Yet in 2018, the records show Avocado shortchanged its residents 184 hours of registered nursing care per day.
And they're not making it up tomorrow or the next day. It is never going to be made up.
Tosh found the 2018 registered nursing care deficit at Avocado was part of a pattern. Avocado shorted its residents more than 170 hours in registered nursing care per day in both 2016 and 2017. Avocado's lawyer John Cajon argued in a written statement that the facility's staffing ratios of registered nurses were in line with California and national averages, but he never addressed why they were not in line with what federal regulators expected. Tosh says CMS's expected RN staffing levels were meant to ensure that residents received the care they needed.
The RNs are the front-line top medical providers in the facility. When you don't have them there, you don't have anybody that can assess the patient, that can determine if they're developing an infection. If you don't have RNs, your healthcare system breaks down in a nursing home.
Avocado's complaint history shows that the facility might have systemic problems. From 2017 through October 5th of this year, 462 complaints were filed against the nursing home, according to the California Department of Public Health. 56 of those complaints were filed this year alone, more than 4 times the statewide average. Cajon, Avocado's lawyer, said many of those complaints were self-reported. He added that given the large size of the 256-bed facility compared to other nursing homes, quote, it logically follows that it will have more incidents to report. But nursing home reform advocates say complaints against Avocado are still high, even when factoring size. Over the years, inspectors have cited Avocado for lax infection control, abuse of residents, falsifying records, and failing to keep the place free of hazards. Avocado has also had the second highest number of residents who tested positive for COVID-19 among nursing homes in San Diego County.
The core issue is that there's inadequate staffing at this facility.
Brian Lee is executive director of the Texas-based nonprofit Families for Better Care.
The residents end up suffering.
By understaffing registered nurses, Tosh calculated that Avocado has saved $1 million or more annually from 2016 through 2018. Yet Avocado has brought in more than $3 million in profits in both 2017 and 2018.
Clearly, when you're making $3 to $3.5 million a year in profit, you could staff properly. I mean, that's the issue in this particular facility, is that this is not a facility that can stand up and say, we didn't have the money to do this.
Meanwhile, the California Department of Public Health investigated Irma Easton's choking death and told her daughter, Beatrice Barrios, that Avocado was not at fault. Barrios doesn't understand that conclusion.
They let her die there. They didn't help her. They didn't provide her assistance in the moment that she needed most. She died in the most painful, horrible way that I can imagine that she would die.
Amita Sharma, KPBS News.